Hello and welcome to Focused RN. I'm your host, Chris Alamina. Did you know that 29 million Americans currently live with diabetes? Diabetes can be either diet or insulin controlled. Today, we're going to be talking about the different types of insulin. Make sure you have a pen and paper ready to take down some notes and stay tuned until the end. Please welcome my guests Ariel and Megan. Today they're here to talk about rapid acting insulin.
Thank you for having us.
No
it's
problem.
A pleasure.
Megan, why don't you talk to me about the uses and what to take, who's it for, about rapid acting insulin?
Okay, well this is normally for type 1 diabetes, but it can also be used for type 2.
Okay.
You want to take it before or during meals, right before you eat. And then if your blood sugar is less than 70 milligrams per deciliter, you do not want to take it because that is too low.
Too low. Sounds about right. And Ariel, can you tell me about the different types of the rapid acting insulin?
Sure. There's three types of rapid acting. There's Lispro, which is Humalog, and Aspar, which is Novolog, and Apidra.
Okay. And I'm sure as far as dosage goes, you can't just take any amount. How does that work?
Okay, you can't. It's on a sliding scale. You can take it with injection, an insulin pump, or it can be inhaled. That's something new that came out in 2015. The effects of the dose, they only change the length of action. They don't affect the onset or the peak.
Okay.
And then the dose that you take can change during stress if you have a major illness, or exercising, eating habits change, or if you're on any new medication. So you want to let your doctor know.
Definitely sounds like a good idea. And the length of action, that could probably be pretty important, right?
Yeah. So I'm going to tell you about the average of length of action and duration. Average, the onset is between 5 to 15 minutes, and the peak is between 1 to 2 hours. And then your duration is between 4 to 6 hours, but average length of action is 4 hours. And it also depends on the dose.
Okay. So as far as side effects go, they can be pretty serious. What are some common side effects?
The most common is hypoglycemia with signs and symptoms of headache, nausea, hunger, sweating, seizures, and increased heart rate. Other things to look out for is weight gain, injection site reactions, diarrhea, and low potassium levels.
Okay. And as far as adverse reactions go?
With adverse reactions, you want to look at your site that you injected it into. If you have any redness, itching, swelling, that's not good. And then anaphylaxis, so severe allergic reaction, dyspnea if you have trouble breathing, any wheezing, your blood pressure goes down, hypotension, if your heart rate is going up substantially with tachycardia, or if you have sweat or diaphoresis.
Those all sound pretty scary. Well, that looks like all the time we have for you two. I appreciate you guys coming. Hello and welcome back to Focused RN. I'm here with Desiree and Ashley, and today they're going to be talking about the short-acting insulin.
Hello.
So, Desiree, how are you doing?
Good, how are you?
Good. Can you tell me, what are some of the different types of insulin?
Well, short-acting insulin, it is used to lower the glucose levels in the blood. Different types of short-acting insulin include Insulin R and Novolin R.
Okay, and when is it used? Like, when would you want to give it?
Specifically, you want to use it right before meals, at least 30 to 60 minutes, and then also before bedtime. It's important to keep in mind that you want to inject short-acting insulin 30 to 60 minutes before eating, and that's to level out the increase in blood glucose with the action of the short-acting insulin.
Okay, and actually, the short-acting insulin, when does it start working?
So it's working within 30 minutes to 1 hour. That's why you want to inject it before you eat. And then the peak time is 2 to 4 hours, and then it lasts as long as 5 to 7 hours.
So it can last as long as 5 to 7 hours. And so, with that, what are some of the common adverse reactions and side effects that you would see?
Common effects are hypoglycemia, lipodystrophy, which is the inability to produce fat, and then pruritus, which is like itching, erythema, and swelling, and anaphylaxis.
Okay, very good. Well, that's all the time we have for today. Thank you, and we'll be back. Hello, and welcome back to Focused RN. I'm here with Stephanie and Christina. Welcome, guys.
Hi.
Thank you for coming. And you guys are here to talk about intermediate acting insulin?
Mm-hmm.
Okay, can you tell me some of the types?
Well, there are several types, but the most important ones are the Humalin N, Novolin N, and NPH.
Okay, and what about the uses? What would you use them for?
They're used for hyperglycemia, and it can be combined with rapid and short acting, and is usually taken about twice a day.
Okay, so Christina, what are the doses for the intermediate acting?
Usually it is in between 0.5 to 1 unit per kilogram per day.
Okay, and the length of action for that?
When given, the onset's going to be around 1 to 2 hours. Peak is going to be around 4 to 12 hours, and then the whole duration is 18 to 24. So it lasts about half a day, or you can go ahead and give it at bedtime so it lasts overnight.
So that's much longer than the fast acting.
Yes.
And adverse effects, side effects, what about those?
The most common ones are hypoglycemia, hypokalemia, itching, anaphylaxis, and erythema.
Okay. Well, thank you guys for coming. Next, we're going to be talking about long-acting insulin. And now for our final segment, we're going to be talking about long-acting insulin. Today I have Mariah and Jasmine. Welcome, guys.
Thanks.
Thank you for coming. So Jasmine, can you tell me some of the types of long-acting insulin?
Well, we have two types. One is Lantus and the other is Levemir.
And what would you use those for?
It's for people with hyperglycemia.
Okay. And as far as dosages go, what would you give?
Well, you can give from 0.2 units to 10 units, and you can administer it once a day, any time of day, but it has to be the same time each day.
Okay, so that's probably important. And Mariah, can these insulins be mixed with other insulins like the other ones?
No, you have to make sure you don't mix any of the insulins together.
Okay. And length of action, I know it's different. It's a longer acting one. Can you tell me about that?
The onset is 0.8 to 4 hours. There's no peak because the duration is 24 hours, so it's just a steady dose.
So the adverse reactions and side effects, can you tell me about those?
Yes, the biggest one is hyperglycemia. You can also get hypokalemia, pruritus, anaphylaxis, and erythema.
Okay. Well, I think that's it. Thank you guys for coming.
Thank
Thank you
you.
for having us.
Now that our experts have informed you about the different types of insulin, it's now time to test your knowledge. Which of the following are considered short-acting insulins? Select all that apply. Which insulin has an average onset of 5 to 15 minutes, a peak of 1 to 2 hours, and a duration of 4 to 6 hours? Which insulin can be mixed with detamir, also known as Levemir?
We can't. I almost died. Yes. Get my shirt. Don't want to look bald.
Hello. Please give a. We should make the whole class uncomfortable.
Yes, that would be funny.
If we're just like, no one smiling, we're just monotone. So I have Ariel and Megan with me today. They're going to be talking about rapid acting insulin.
Signs and symptoms of hypoglycemia is wait.
Yeah, take your time.
Hypoglycemia. Stare straight at the camera and say hypoglycemia.
The most common is hypoglycemia.
Quiet on the set, please.
Yeah.
Quiet on the set.
All right, take 3.
Action. Most common is hypoglycemia. Hypoglycemia, you can find like headaches, nausea, hunger, sweating.
Well, dude.
Take 4.
Look in here.
Ready?
Posture. Take a deep breath. Take a deep breath.
Spare fingers.
Just fingers.
Important, scary for some people. What are some really... Take 5 or 6, whatever. Thank you, and we'll be back.
Thank you.
On the side effects with the...
Oh my gosh. Fly just hit my head.
Stephanie!
Nope. Almost.
Let's
It's,
see.
I feel like it's dying. I don't want to break the board. I almost did. I can maybe get it with my hands. You got it, Tasha.
Just, you gonna get it?
Step on it.
Tommy. I feel like I can, because it's like
Yeah.
weak. He's
Oh.
He's get the board.
She
I
said-
touched it.
Most importantly, hypoglycemia.
Oh my god, you said insulin.
It can disturb.
Hypoglycemia, hypokalemia, Ready?
Okay, welcome back.
I'm so sorry, you guys. I don't know what my dealio is.
All right, well, thank you guys for.
Oh my god.
All right, well, thank you guys for coming. I appreciate it. What was wrong with that?
Anaphylaxis and
Anything?